Good afternoon, everyone. Last week we started with the upper limb anatomy and we could complete the upper arm. So today we'll go into as a continuation of the last week lecture, we'll go into the forearm anatomy. So today we'll look the flexor group of muscles of forearm first. So these flexor group of muscles are divided into layers: superficial, intermediate, and deep layers. So as a beginning, we'll start from the superficial group and the intermediate group. In this group, anterior forearm superficial layer, there are four muscles which are originating from medial epicondyle of humerus. They are namely pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. You can see all three muscles are originating from the humerus, medial epicondyle of humerus. First muscle is pronator teres in this superficial group, flexor muscles. So sometimes it's abbreviated as PT. This muscle originated from the medial epicondyle and these five of the humerus, and these fibers runs inferiorly and laterally to attach into the mid shaft of the radius. So this muscle originating from the medial epicondyle and these fibers running inferiorly and laterally to attach into the mid shaft of the radius. So pronator teres, its name itself, it gives us a clue about its function. So main function of the muscle is pronation of the forearm. So and teres means rounded. So in this muscle, if you do a cross section, you can see as a rounded muscle. So this muscle is named as pronator teres. So it's originating at the medial epicondyle and attaching at the mid shaft of the radius, and its main function is pronation of forearm. So these fibers running downwards inferiorly and laterally and attaching into the mid shaft of the radius. So the second muscle is flexor carpi radialis. Flexor carpi radialis, we call it as abbreviated as FCR, flexor carpi radialis. This muscle also has the common origin, originated from the common origin at medial epicondyle of humerus. So they all three flexor muscles have common origin. So it's originally from the medial epicondyle, and these fibers runs out inferiorly and laterally. This muscle, unlike the pronator teres, these muscles crosses the wrist joint. This muscle crosses the wrist joint and it goes and insert into the carpal bones, namely second and third metacarpal bone, base of third and second metacarpal bone. So what name of the muscle is flexor carpi radialis. So its name itself gives us a clue of its function, its flexion. Does the flexion, and it's a flexion engaging the carpus bone. That's why it's flexor carpi. And radialis means it's located the radial side of the forearm. So flexor carpi radialis. Its main function is flexion of carpal bone. It's located just medial to the pronator teres, originated from the medial epicondyle and inserted into the second and third metacarpal bones. So this is flexor carpi radialis. This is our second muscle of the flexor group superficial layer. Next muscle is palmaris longus. We abbreviate it as PL. It's a very small muscle line medial to the FCR, flexor carpi radialis, just medial to flexor carpi radialis, and it's also originated from the medial epicondyle, and it's also going passing the wrist joint and insert into palmar aponeurosis. In 10 to 15% of the population, this muscle is missing in one side of both arms. So this muscle considered as an accessory muscle. And however, the persons who are having this muscle, it's very useful whenever you do reconstructive surgeries. So even this small muscle, it's very important. It plays a small important role when we are doing plastic surgeries for the reconstructive purposes. Then our third muscle, now we have gone through three muscles. First PT, then FCR, now PL. All three are originating from the medial epicondyle and fibers running down to the inferior direction. The flexor carpi ulnaris, the last muscle of this group, is the FCU or flexor carpi ulnaris. This is also originated from the common origin at the medial epicondyle. Lies on the ulnar side of the forearm and runs down straight away down to the pisiform bones, and inserted into the pisiform bones, it crosses the wrist joint. So these four muscles which we learn are considered as superficial layer of the flexor compartment. Flexor carpi ulnaris, its origin is medial epicondyle, insertion is pisiform, action is flexion of wrist. So these four muscles considered as the muscles of the superficial layer of the forearm. So when we speak about the innervation of these muscles, so pronator teres, flexor carpi radialis and palmaris longus, all three muscles get their nerve supply from the median nerve, while flexor carpi ulnaris get the nerve supply from the ulnar nerve. So this is the last muscle of the superficial layer of the flexor muscle, flexor carpi ulnaris. So till now we have learned four muscles, all are originating from at the medial epicondyle of humerus, and all runs inferiorly, and out of that three muscles are getting the nerve supply from the median nerve, namely pronator teres, flexor carpi radialis and palmaris longus, and flexor carpi ulnaris gets its nerve supply from the ulnar nerve. So these are the superficial layer of the flexor compartment. So here you can see all four muscles of the superficial layer originating from the medial epicondyle, runs downwards, and pronator teres attached to the radius, innervated by the median nerve. Flexor carpi radialis attaches to the second and third metacarpals, innervated by median nerve. Then flexor carpi ulnaris attached to the pisiform, innervated by ulnar nerve. And palmaris longus attached to the palmar aponeurosis and innervated by median nerve. So now we have dealt with the superficial layer. Now next is the intermediate layer. In this group we have only one muscle, that is called flexor digitorum superficialis muscle. So this muscle originated from the distal originating from the medial epicondyle distal location. So this muscle originated as a single muscle belly, and it's this intermediate layer muscle, it goes downwards toward the digits. So in the mid of the forearm, somewhere mid of the forearm, it's divided into four muscle bellies, and they will cross the wrist joint and go towards the digits, and that tendon will be attached to middle phalanx of second, third, fourth and fifth fingers. So it has some action of flexion at each joint it passes, but main function is the flexion of digit. So you see its name is flexor digitorum superficialis. It's doing flexion of what? Digitorum. Now there is word superficialis. That means there should be another muscle deep to it. So when we go further, we'll come into that. So till now what we have learned now: superficial layer, 4 muscles, then intermediate layer, 1 muscle, flexor digitorum superficialis, FDS. So this muscle is entirely innervated by the median nerve. So in this flexor compartment, superficial 3 muscles get median nerve innervation, and FDS also getting median nerve innervation. Flexor carpi ulnaris getting the innervation from the ulnar nerve. So now this flexor digitorum superficialis origin is medial epicondyle, insertion is the middle phalanx of second, third, fourth, fifth fingers, and function considered flexion of digits. Now in this picture we can see superficial dissection of the forearm. First muscle we see here is brachioradialis in red color. In this you can see in the radial side. It's from the arm. This muscle is from the arm. It's not a part of flexor muscle of the forearm. It's starting from the arm, running all the way to the distal radius. Actually this muscle is not part of the flexor group of muscles, but belongs to the extensor group, but seen in anterior vintage point. That's why we explain it in this position. Otherwise, people who are learning may get confused. This muscle is an extensor group, but it's visible here in the anterior forearm. So, next muscle you see is pronator teres. Pronator, it's actually one of our flexor muscles. So this pronator teres, as we know, you can appreciate it's originating from the medial epicondyle and it runs downwards to up to the mid shaft of the radius. So here this pronator teres and brachioradialis, there's a muscle between these two. It is brachialis, make the flow of cubital fossa. So in between brachioradialis and pronator teres is the cubital fossa. So you can see the brachioradialis. To see the brachioradialis, we have removed the in this dissection we have removed the structures in the cubital fossa, neurovascular structures such as brachial artery and median nerve, as well as the bicep tendon. So now we went through three muscles. These three, what? Brachioradialis we can identify, brachialis and pronator teres. So this brachialis muscle originating from the mid-arm and it crosses the elbow. This muscle make the flow of cubital fossa. So structures of cubital fossa such as bicep tendon, neurovascular structures such as brachial artery and medial nerve has been removed in this dissection to enable us to see the brachialis muscle. Now let's go back to the flexor muscles in this compartment. This is pronator teres. So next to the pronator teres is the next muscle you can see here is flexor carpi radialis. Flexor carpi radialis, you can see it's also originated from the common origin and it's run towards the radius and inferiorly, and also go all the way to crossing the wrist joint. So next muscle you will see here is flexor carpi ulnaris. This is the most lateral muscle of this flexor group. So it's medial muscle. So it's starting from the medial epicondyle. It's goes downwards, crossing the wrist and inserting in the pisiform and lies in the ulnar region. So here other muscle you can see, you may expect in here to see the palmaris longus, but in this individual palmaris longus is absent, so we can see the flexor digitorum superficialis. It's from the intermediate group. So now we have gone through the flexor compartment, superficial layer and intermediate layer. What are the muscles we discussed? Pronator teres, flexor carpi radialis, flexor carpi ulnaris, palmaris longus, and flexor digitorum profundus. Other than that, we could identify the brachioradialis and brachialis. So in next slides, we will go to the deep muscles of flexor compartment, flexor muscle group.